Recently there's been a procedure that's become popular, and it's called the fox eye procedure, and the idea is to make the eyebrows have a nice arched appearance. The only thing is that this PDO thread that's being used is not the best way to achieve that. At least that's what I think. So what I've done is set up a little demonstration so you can see why I think it's not the best way to do it. It's a clear barbed suture, and the barbs are made to go in the opposite direction as the passage of the suture, and the idea here is to send that suture down across the temple, and then once it's in place, pull up on it, which sounds like a very easy way to achieve that arched eyebrow. The only thing is that the way that arched eyebrows are produced with this, there's a chance of having the string kind of pull in an uneven direction and in different amounts in different places along the suture. I think that there's a surgical method that works a lot better, and it's permanent and very predictable, and you get a very smooth result as well. So for the purposes of demonstration, I'm going to be using this leg of a chicken who donated his body to science. And the reason for using this is that the structure of this chicken leg, as far as the way the skin and the muscle and everything are put together, I'm going to show you how that eyebrow is lifted up, and you can see the eye and the eyebrow. And what we're going to do is try to get it so the corner of that eyebrow comes up using this. Here we got an eye and the eyebrow, and the corner is going to get pulled up in this direction here. What I'm going to do now here is to pass this needle from where the hairline would be, which is way up here, and it's going to go underneath the skin in front of the muscle, going all the way down here to where that eyebrow is, and it's going to come out right here within the eyebrow. Now I'm going to pull this down, and those barbs, since they're pointing in this direction, slide easily through when you're going this way. When I pull it in this direction, there's no drag on the suture at all. It's because those barbs are pointing in this direction, so it slides easily going that way. But those barbs now, they'll engage the skin when it's pulled back like this, and when I pull it back, you should be able to see where it's pulling on the eyebrow corner right there. So that brings up the corner of the eyebrow just a little bit. This is the problem with it. Well, if you pull enough, it'll actually, you can see the string actually sliding underneath it. And when that happens, it's grabbing different areas more than it is other areas. When I pull on it, you can see what it's doing. It grabs these different areas differently, and it can slip from underneath there, here or here, and grab it more here or here. So what that means is you can potentially get a very uneven lift. You should be able to tell based on what I was demonstrating that when that string is pulled, it may be a little uneven, and for some people it's not permanent at all because those little barbs will slip. The other problem is that it's probably not going to last very long, which means that whatever you spent on doing this is going to have been a waste before too long. It's a very simple thing to do, but doing it in a permanent way is actually not much more complicated than that. The procedure that I like to do, which is technically a surgical procedure, but it's really very simple, is a permanent way of doing this, and it's very predictable because when I separate the skin away from the structures underneath it and gradually lift that up and make sure that it's even, it's not going to be held underneath the skin, it will only be held by what's in the scalp, and that's where you get a nice even lift. And the patients can see it right away because as soon as I'm done, I can give them a mirror, and since they're awake, they can look at it and realize it looks exactly the way they want it to. The more permanent way of doing this is to take out a small ellipse of skin that's way above the hairline, so it's hidden inside the scalp. And by taking out a piece of that scalp here, when I close that, it'll pull the skin up, and it's a much stronger hold. I actually can separate the skin from the muscle that's underneath it, and by doing that, pulling on the skin does not allow it to grab on anything underneath that, so you get a very nice even lift all the way up to the hairline. And once this is pulled up and closed, then that's it. Nothing else needs to be done with it. And I can really fine-tune that adjustment because it's totally controlled by how much skin is taken out above the hairline. This is a very simple procedure to do. It takes me about 45 minutes. I do it here in the office, and it's just with local anesthesia. If this is something that you've been considering doing, please give me a call. I'm happy to explain exactly what can be done and show you on your own eyebrows what the result would end up being, because like I said, it's a very predictable result. You know, when women get a chance to see what this result is like and they realize they don't have to keep going back and doing things, they're universally happy with it, and it makes their eyebrows look exactly like they wanted, and it does not have to be a ridiculous, really arched, pointy eyebrow look either, because again, while I'm doing it, I can position an eyebrow exactly the way it should be, and I show the patients before I'm done and before everything's closed, so they know exactly what it's going to look like.